Christensen here from Chandler Physical Therapy, talking about the bridge today. It's a super common exercise when we're looking at low back pain, when we're looking at hip pain, and really just ways to increase hip and core control. But one of the big things that I find is that it is performed quite poorly overall. And so I wanted to kind of discuss maybe some finer points so that if you are doing the bridge, you're getting increased low back pain, maybe you can fine tune that just a little bit. So what we're looking for when we see the bridge, let me pull this up here really quick. And this is going to be one that is maybe not the best form here, okay? And what we're looking at here when we see this picture is that the low back is arched. And this young lady here is actually moving through the low back versus the hip. In a good bridge, we should see you move through your belt buckle, not your belly button. And right there, she's arching more from her belly button than she is from her low back. And that can lead to an increased arch of the low back and often pain with that. A lot of folks' issue with the low back is that they're excessively arching. So when we see that and we incorporate that with a bridge, maybe even add load, that can actually exacerbate pain to some degree. If we contrast that with something that looks like this, we see that this young lady here, she's not arching through her low back, and she's using what we call a pelvic tilt. So her stomach is not arched. She's lifting more from her hips than her belly button. And you can see that, relatively speaking, her midsection is a straight line from shoulders to hips there, which is really what we want. We don't want the low back to move during the bridge. We want the hips to participate. But very often we see that the hips don't participate and we overcompensate with the low back. The other thing that we very often see is that folks will very much, let's go back to this one, push, well, it's kind of hard to see in this picture, so we'll just kind of abandon ship on that one. Very often will push through their toes more than their heels. And when you're pushing more from your toes than your heels, that incorporates more of your thighs as opposed to your glutes, making it easier to arch through your low back than keep that core neutral. So some things that you can do to be very mindful of this is give yourself what we call a pelvic tilt. Lock that pelvis back a little bit to make sure that you're not arching through your low back. A lot of folks will say, hey, let's flatten that low back to the table, but you want to maintain that as you come up. And what I tell my clients is that you need to tilt, lift, and then recheck your tilt again, because very, very commonly we've lost that tilt as we started to rise. And so being aware of that, it matters less to me how high you go. It does matter that you maintain that pelvic tilt. And then you can also bring the feet more narrow together and use something to hold between the knees, as that activates the core a little bit, and you can actually maintain better core control that way. So if you guys do have questions, obviously we'd be more than happy to check it out. We do have, hopefully this pops up. Yep, there we go. A free discovery visit. You can give us a call, check it out if you have questions. But if you are bridging, you're having extra pain with it, try to correct these, make sure you're not making these simple mistakes, and we'll catch you on the next one.